to Governor Whitmer's executive orders issued in response to the COVID-19 pandemic, this meeting is being held remotely via WebEx. All attendees are automatically muted. Any citizen who has made a request to address the board will be identified and unmuted when it is his or her turn to speak. The meeting will be recorded and posted on the Board of Commissioners webpage under the meeting video archives. So let's start with the Pledge of Allegiance, gentlemen.
And ladies.
Thank you.
I pledge allegiance
To the flag of the United States of America.
to the republic
Which it stands,
one nation, under
under
God,
God,
indivisible, with liberty and justice.
liberty and justice for all.
Roll call, please.
Commissioner McConnell.
Here.
Commissioner Baldwin.
Here.
Commissioner Heidemann.
Here.
Commissioner Dunn.
Here.
Commissioner Rushing.
Here.
Commissioner Greatop.
Here.
Chairman Bohm.
Here. Items 3, additions, deletions, changes to the agenda, items A and B.
Mr. Chairman, at this time, I move to add COVID-19 preparedness and response plan as item 11O and add COVID-19 update medical health officer as item 11P. Or
Questions? All in favor?
Aye.
Aye. Those opposed? Do I have approval for the agenda?
moved.
Who's that?
Senator Heidemann.
Do I have a second?
Second. Heidemann.
Okay. Favor?
Aye.
Those opposed? Item 5, minutes of previous meeting. Item motion.
So moved.
Support.
Any discussion on the minutes of the previous meeting? All in favor?
Aye.
Aye. Those opposed? Okay, no proclamations. Item 7, the consent agenda. Item A, H.
Hey, Jeff, did you, agenda item 5?
No, we did that already.
I didn't see did that. Second.
Georgia.
Georgia. All right, items, consent agenda. Move to approve item 7A through 7H on the consent agenda.
Support.
Question on any of these items? All in favor? Aye. Those any reports of standing and special committees. I'm going to start with Howard.
None.
Georgia? Bill Greatop.
Yes.
Greg McConnell.
The only thing I have is that, and I don't know if the sheriff is going to be on tonight or, if he was calling in, he was going to try. Sheriff Donnellan is not running for re-election in the November race. We will have a new sheriff as of January 1st next year. And if you get a chance to give Tim a call, I think Tim's done a really good job keeping us with a very fine department, and he's very well respected. And just hope that Matt King can do as good a job, and he'll have big shoes to fill. But I'm sure he'll do a great job with the help of people around him, and everything will be good. So that's all I have.
Yeah, I actually just received that email today from him saying that he was not going to be running. I know he sent it out to the board, so some of you may have, you will be receiving that notice also.
Mr. Chairman, if I could ask a question on that, and maybe Jay, this might be addressed to you.
Yep.
That on the 21st of April was the last filing date for partisan. Is there an extended period of time for nonpartisan? Could a nonpartisan run for the sheriff's office?
Yeah, there's a filing deadline for that. That would be for the November ballots in July. I'm not going to give the date out because I don't have it at my fingertips. I don't want to give the wrong date, but it's a July date for a nonpartisan.
Okay. Okay, very good. David? Duke?
No, sir.
Well, Greg already gave his. I'm going to take a pass, so we're going to move on. There are no citizens wishing to address the board at this time. So item number 10, unfinished business. There's no unfinished business. Item 11, we're going to go into new business. Item 11A.
Chairman, I move to approve the 2020 County Veteran Service Fund Grant Agreement in the amount of $117,263.
Support McConnell.
Okay, any discussion? Roll call.
Commissioner Baldwin,
Yes.
Commissioner Dunn,
Yes.
Commissioner Rushing,
Yes.
Commissioner McConnell,
Yes.
Commissioner Greatop,
Yes.
Commissioner Heidemann,
Yes.
Chairman Bohm.
Yes. Item B, the MSU office closure request for May 20th.
Mr. Chairman, move to approve the closure of Michigan State University Cooperative Extension Office on May 20th, 2020 for all staff meeting.
Support.
Heidemann.
All in favor?
Aye.
Aye.
Jeff, let me jump in for just a minute. Guys, when you're seconding these things, all you got to do is just say your last name. That'll be a second. That way I can get it. I couldn't hear. There were 3 people seconded.
Little housekeeping details. Item C, resolution 20-7.
Mr. Chairman, move to adopt resolution 20-7, placing the proposed transportation millage renewal on the ballot.
Done.
Any discussion? All in favor?
Aye.
Aye.
Opposed. Item D, the resolution 20-8, the equalization report.
Chairman, moving to adopt resolution 2008, approving the 2020 equalization report.
Heidemann.
Discussion.
Yes. Jeff, just wanted to comment, Justin did a great job on that graph comparing state equalized value with taxable value. Just wanted to point out, still below what we were getting in 2009 in terms of taxable value. The state equalized value is just above what we were getting in 2009 as state equalized value. That's an interesting graph. Justin did a nice job.
Yeah, I agree with you. All in favor?
Aye.
Aye. Those opposed. Item E, resolution 20-9.
Mr. Chairman, I move to adopt resolution 20-09, placing the proposed drug task force millage renewal on the ballot.
McConnell.
Any discussion? All in favor?
Aye.
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 Those opposed. Okay, moving on. Item F, the agreement with the City of Marine City for assessing services.
Mr. Chairman, move to approve the agreement with the City of Marine City for assessing services for a term of 5/1/2020 through 4/30/2025 in the total amount of $188,053.
Baldwin.
Any discussion on this? This is another one, as you guys probably well know, our assessing, we do the assessing for a handful of jurisdictions out there, and this is just another one of those agreements, so. Roll call.
Commissioner Heidemann,
Yes.
Commissioner Dunn,
Yes.
Commissioner Greatop,
Yes.
Commissioner McConnell,
Yes.
Commissioner Baldwin,
Yes.
Commissioner Rushing,
Yes.
Chairman Bohm.
Yes. Item G, the agreement with Port Huron Township.
Mr. Chairman, move to approve the agreement with Port Huron Charter Township for assessing services for a term of 5/1/2020 through 4/30/2025 in the total of $346,076.
Rushing.
Any discussion on this? Roll call.
Commissioner Rushing,
Yes.
Commissioner Heidemann,
Yes.
Commissioner Baldwin,
Yes.
Commissioner Greatop, Commissioner McConnell,
Yes.
Commissioner Dunn,
Yes.
Chairman Bohm.
Yes. Item H, the proposed severe communicable disease outbreak policy.
Mr. Chairman, I move to approve, to temporarily suspend the rule requiring 30-day absence prior to adopting a policy and policy 138, severe communicable disease outbreak, staffing and services consideration policy.
Done.
Uh, um, Any discussion? All in favor?
Aye.
Aye.
Those opposed? Item I, the maintenance agreement with Entrado Life and Safety Solutions Corporation for Central Dispatch.
Mr. Chairman, move to approve the maintenance agreement with Entrado Life and Safety Solutions Corporation for Central Dispatch for a term of 3/24/20 through 3/23/21 in the amount of $40,000.
McConnell.
Any discussion? Roll call.
Commissioner Dunn,
Yes.
Commissioner Rushing, Commissioner McConnell,
Yes.
Commissioner Greatop,
Yes.
Commissioner Heidemann,
Yes.
Commissioner Baldwin,
Yes.
Chairman Bohm.
Yes. Item J, the Intervention Center proposed manning table revision for laundry worker, laundry.
Mr. Chairman, to approve the Intervention Center Manning Table revision, eliminating time worker laundry positions and add a full-time worker laundry position.
McConnell.
Discussion. All in favor? Those opposed? Item K, the Intervention Center bidirectional antenna installation.
Mr. Chairman, at this time, I move to award the installation of bidirectional antenna at the Intervention Center to ComSource in the amount of $99,136.15 and the purchase of associated radios to Spectrum Wireless in the amount of $100,043.81.
McConnell.
Discussion. Roll call, Jay.
Commissioner Greatop,
Yes.
Commissioner Dunn,
Yes.
Commissioner Baldwin,
Yes.
Commissioner McConnell,
Yes.
Commissioner Heidemann,
Yes.
Commissioner Rushing,
Yes.
Chairman Bohm.
Yes. Okay. Item L, the amended agreement with Six Rivers Conservancy for additional land acquisition.
Mr. Chairman, it gives me great pleasure to approve the amended agreement with Six Rivers Land Conservancy for North Channel land acquisition for the Parks and Recreation Commission, parentheses, South Park.
Done.
Bill, do you want to just give us a little backdrop on what this is?
Yeah,
addition to?
when we looked at the original set of properties, it was in the 9 to 9.5 acre piece, with the addition of Joe Stevenson's property, which runs right along the property line and takes us right up to the fence, separating us from the North Channel DNR launch site. Gives us much better access in that form, should we ever decide to cooperate with them in some form. This additional property will add probably another acre to 1.5 acres into the park. This also raises the value of the property even more than what we paid for it. Which helps us with our DNR land grant trust fund. Still hanging out there, though, is the piece from the Algonac Harbor Club that has not been determined yet, but most people seem to think it's coming, and when it does, it will also add additional value to the property, making the grant even more, what's the word I want here?
Reliable?
Enjoyable, whatever to the DNR land grant trust fund people. So we're going into this thing in a very, very good position because of this recent acquisition and a possible another one. By the time it's all said and done, we may have grown from a 9 acre park to a 12 acre park.
Bill, Can I just
Yes.
ask a question really quick? Is it that whole piece that has the house and the commercial building on it?
Commercial piece stays with the original owner, Jay. Go right behind his place and you'll see a garage right behind there, and behind that is the house. The garage and the house all the way back will belong to the Parks or to the Park Commission.
Gotcha, thank you.
He's going to keep that front piece up front there.
Yeah.
Okay.
Thanks, guys.
All in favor?
Aye.
Aye.
Those opposed? Okay, moving on, the professional services agreement for the cost allocation plan.
Mr. Chairman, move to approve the service contract with MGT America Incorporated for the preparation of the countywide and health department cost allocation plans for a term of 3 years in the amount of $61,500.
Rushing.
Any discussion on this? Roll call.
Commissioner Rushing,
Yes.
Commissioner Heidemann,
Yes.
Commissioner Dunn,
Yes.
Commissioner McConnell,
Yes.
Commissioner Graytop,
Yes, sir.
Commissioner Baldwin,
Yes.
Chairman Bohm.
Okay. Item N, the 2002 Census Support Funding Grant.
Mr. Chairman, move to approve the community census support funding for the 2020 census from the Michigan Municipal League in the amount of $49,040.
Done.
Okay. Any discussion on? Roll call.
Commissioner Heidemann,
Yes.
Commissioner Baldwin,
Yes.
Commissioner Dunn,
Yes.
Commissioner Graytop,
Yes.
Commissioner Rushing,
Yes.
Commissioner McConnell,
Yes.
Chairman Bohm.
Yes. Item O, the COVID-19 preparedness and response plan.
Mr. Chairman, move to approve the COVID-19 preparedness and response plan.
Rushing.
Any discussion? I just want to say, Bill Graytop and I were actually out there today with Trevor Lauer from DT, and they were donating some masks. I got an opportunity to talk to Justin for quite a bit. I think they've been doing a very good job. Justin, Doc really taking the lead on this, and very organized. I know we get a lot of information pushed out to us. They're, I think, like I said, doing a really good job. Dan Casey with the EDAs handling a lot of the small business questions. I've been directing those individuals to them, and then, you know, Carrie is obviously handling the county business day to day. Really, our job as commissioners are to put proper people in proper places and support them in their efforts. So I just like to commend everybody on that. Okay, all in favor?
Aye.
Aye.
Those opposed? Item B, COVID update, medical health officer. Not sure, were we going to have?
Hi.
Hello?
Hi, can you guys hear me?
Yeah, we can hear you.
Dan.
Oh, good, good. So this is Annette Mercatante, and I guess I should just apologize that I'm just now getting in front of you guys. This event's been obviously going on a while, and I just want to make sure you know that I'm available to anytime you want to talk. Hopefully today, I just want to go through some basic stuff and then go over our data with you. Not so much to share with you the individual numbers, but there's been a lot of questions about where we get the data and why it's different from the state, and I'm hoping to kind of go through that with you a little bit today to have a better understanding of what we're doing. So next slide. Whoever's doing the slide progression. I don't think I can do it, can I? Okay, so I'm sorry. Is this the first one? Okay. So I'm going to start out with some basic stuff that you guys need to understand. It'll help a lot with the confusion, especially as we get into reopening phases where we talk about what we're going to do with employees. The most important thing is the definition. One of the important things, excuse me, is the definition of cases. And one of the obvious things is a confirmed case is somebody who is sick or has died with a positive test. And right now the testing is something we call PCR testing. It's sent off. We do not have the rapid. It's done immediately on site, and it's still a few days turnaround time. This is different than some of the antibody testing that you've been hearing about. We can talk about that a little bit more if you want. But that is what is a confirmed case. Somebody who's had that PCR testing, which is the standard testing we're doing right now everywhere. Next slide. So there's another way of defining a positive case. Got the next. Oh, you know what? I keep looking at the wrong thing. I need to get rid of that. I don't know. And that is a probable case. And we have been using this definition now for a couple weeks. The CDC and the state are both using this definition. They are lumped into total positive cases. But in a probable case, you're going to have an individual who presents with all the signs and symptoms of COVID, primarily the respiratory, the fever. Sometimes there's classic pneumonia patterns on x-ray, and they don't necessarily need a positive test. Or they might have a test that's not acknowledged as standard, such as the antibody test. The other piece they need, though, is to come from a place that has widespread transmission, or they've been exposed to somebody who's known to have COVID. And we count both of those because St. Clair County is a widespread transmission zone. In other words, we have enough COVID circulating that you can assume there's been exposure if somebody's presenting with that. So there are two definitions of positive, a confirmed and a probable. We have been lumping them together, and I just want to warn you that I believe the state is going to start separating those out, and if they do it, so will we. And now you're going to have a lot of people asking you what's the difference. So that's the difference. It's just a different way of defining it. Next slide. So how do we decide who's recovered? And we use two very specific definitions, which are different than the definition the state is using. Don't ask me why. We are using the definitions that have been defined right from the beginning through the CDC. One is clinical, which means if a person is improving, they're feeling a lot better, and it's been at least 7 days from the day they got sick, and they've had 3 days without a fever, we consider that a clinical recovery, and we've been allowing people to stop their isolation based on that criteria. A second way of defining recovered is through repeat testing, where you repeat somebody's nasopharyngeal swab and it becomes back negative. And technically, the definition is 2 negative swabs 24 hours apart. We have not been using that criteria for recovered because we haven't had enough tests, and we wanted to save our tests for diagnosing people. As our testing supplies become more available, this second mode of definition of recovering is going to be used more and more, especially with high-risk individuals, healthcare workers, etc. We're going to be requiring them or requesting them to have testing, repeat testing done, and waiting to have 2 negatives to call them recovered. That's a really important distinction. You're going to start hearing a little bit more about that. The state uses a completely different definition. They've decided to compare death certificates 30 days after somebody has been declared positive, and then if they're not dead, they're recovered. We just can't use that definition. We don't have the opportunity to filter through death certificates every day. So I would just recommend that if people ask you that definition of recovered, you kind of send them to our website where this is all available, or share this information if you can remember it. So any questions about how we define cases and how we define recovered individuals? Okay, next slide. So 2 more real quick definitions, next slide. There's a difference between these 2 terms, isolation versus quarantine. And I guess I wouldn't get too far in the weeds. It makes a big difference to us as a health department, but in the general public, media, they interchange these words constantly. But to us, you isolate an individual when they're sick, and you want to separate them from other people who are not sick. That's isolation. So we send them home. We make sure that they stay away from their families. They stay in their rooms. We have a whole list of things we tell people to do when they isolate. Quarantine is when you have somebody stay home because you think they're exposed, but they're not sick yet. You just want to make sure that if they get sick, that they aren't about talking and being with a lot of people. And the quarantine period for COVID is 14 days. Okay, it's different than the period we keep people isolated. I just went through that. We keep people isolated till they're recovered by those 2 definitions. People who have been exposed and we're waiting to see if they get sick is going to be a 14-day period. And so there's a lot of confusion about that. I just wanted to make sure you understood there's an important distinction about those 2 terms. Next slide. Go on. So I'm going to go through the data with you guys. Not so much to focus on numbers, just kind of give you an idea of where this information comes from and what it means. So we publish this every day. We pull the data at the same time every day. What time is that, Anthony? Around 8:15. And the reason we do it every day at the same time is because if you pull this information an hour later or 2 hours later, it will be different. We use a Michigan data surveillance system, which is a statewide system for disease reporting and surveillance. And our nurses, our team of nurses and staff work on this constantly, several of them at a time, putting people in, taking them out, doing the investigations. If, for instance, they find somebody in the system that's not from St. Clair County, they remove them. And so this is a very fluid data system. It is not final data. And so when we report these cases 8 o'clock, it is in fact what's in the system at 8 o'clock. And at 10 o'clock, when the state pulls the data out to report on their system, it's very likely going to be different because our staff's been working for a couple hours on it. We are the only people, well, I shouldn't say that. The whole state is adding and changing this. So if Macomb County has a case in their database and it's ours, they'll flip it over to our side. So just to give you an idea of why these numbers vary. So our total cases, we add them up. It's cumulative. Our hospitalized cases, we're reporting those cumulatively. And those are hospitalized cases that we are told about directly. The hospital reports this to us, or we do our case investigation, talk to the person and find out they were in the hospital. So this is a direct investigation report. The deaths, likewise, we are notified directly of the deaths from hospitals or our medical examiners. Every once in a while, again, one will get lost. It'll be sent to us from another county. And then finally, we're reporting the number of recovered, and that's based on that definition I gave you earlier. That is based on the direct indication from our staff when they talk to people that they have been removed from isolation and deemed recovered. So those numbers are real, they're cumulative, and there's nothing folksy or different about it, but I know when people sometimes try and add them up or subtract them, they're not consistent. And I just want to share the fact that these are not finalized numbers. We haven't gone through them and plucked out. This is real-time information that we pull directly from our system. So that's an important characteristic. Now the second box there, the updates are taken from a daily data information sheet that all our hospitals and long-term care facilities report to by noon. And what they do is they report the number of beds, the number of ventilators, the number of ICU patients, and they report on how many of those are COVID. So we picked those two indicators because I know people worry, are our hospitals getting overloaded? And are our hospitals filled up with COVID patients? And again, rather than report numbers, which fluctuate greatly, we thought that reporting this by proportional, a percentage, will give people that information in the same way. So you can see from that update, and actually the one in front of me today, we have 38% of all our hospital beds are available, so it's kind of holding steady, and we still have 7% of our beds that are COVID related. So that's holding pretty steady, and we watch that every day very closely to make sure that we're not seeing surges or increases in our hospitals that would engage more activity. And then we report on the new cases just by doing simple subtraction. And there's always some variability. New cases do not mean they are the new cases that were diagnosed that day. It means they're the new cases that we found in the system compared to the yesterday's data. And sometimes they bump up. For instance, today, there are 21 new cases reported. That's not because we had a sudden increase in people getting infected. It's because there was a whole bunch of cases that got put in because their addresses were wrong. I think they put in some jail data that wasn't in there. And, the labs just get put in, and so we report them. So be careful when you read these numbers that you look instead that they're a tool for us to understand where we are and where we're going. But they're not absolute numbers. They're not scrubbed. They're not finalized. So it's been a real source of headache for us. The general public is just, so as you know, we've also tried to change our graphs several times just to try and make people happier. Next, and then we do the demographics at the bottom, which is no surprises. We're seeing the same demographics as the rest of the country. The older you are, the more likely you're going to be hospitalized, pretty even back and forth between male and female. Let's do the next slide. And then I'll wrap up and let you guys ask some questions. So our graphs are there to try and indicate which direction we're going. And as you can see, we have a steady increase in cases. The second line on the bottom in this case is recovered cases. So you can see that we have a steady rate of recovery, and that difference between the top of the graph and the recovered case is pretty steady. So we're in a good place. We're not suddenly getting a whole rash of really sick people that are dying. It's pretty standard, and that difference is what we're looking at. The volume under the curve are the total number of people who've been infected so far. And then the next slide is the same graph, but displayed on there are deaths and hospitalizations. And this is also good to see, and it's reassuring because you can see we have not really a big increase in hospitalizations. I can't really explain this. I would actually expect the hospitalizations to go up as the cases do. But it does seem that our hospitalization rates are pretty flat, as well as our death rates are pretty flat. The more cases we have, the more deaths we're going to have. There's a pretty standard case fatality rate with this disease, probably not going to be much more than 2 or 3%. But as the numbers go up, those numbers of deaths are going to go up as well. And then finally, the county map. There was a big clamor for everybody to know where all these cases were. And so we started using townships as an indicator. I want to be very clear about this map. Just because you live in Greenwood Township with 0 cases does not mean you have no chance of being exposed to COVID. There's probably more cows than people in Greenwood Township, right? So what you should see from this map is that we have COVID cases all over the county, and that most of the cases are clustered in areas of higher density of people. Where there's more people, there's more cases. And I think demographics play a role. That when you're poor and you're living more people to a household, much greater chance of sharing it with each other. And so this map makes everybody feel better, but I want to be really clear, it doesn't make me feel any better. And I don't think there's necessarily a hot spot that's really bad in our community. I just think areas that are more heavily populated have more cases. So I wouldn't be more hesitant to go into Port Huron than I would be into Algonac or downriver. That's not what this map means. And I know that's how it's interpreted sometimes, but anything else, Anthony? I do have Anthony Lai here with me. He's my informatics specialist, and he's been working very hard at getting this data out in a way that's meaningful to people. So if you have any detailed questions about data, I want you to speak out. Next slide. I think I'm done. I think that's all I had to share with you. So any questions?
Yeah, I'm going to open up for the commissioners for some questions. Just, I want to say, Annette, you guys have been doing a wonderful job getting information out, updates, all that. I know you and Justin are working hand in hand, and Bill Graytop and I were working out there, we're out there earlier today with DTE, and I seriously want to thank you for everything that you can do. And as commissioners, as I said earlier, it's really our jobs to support. You guys are the lead on this, and it's our jobs as commissioners to support your efforts. So thank you. Do I have
I appreciate that. This has been, go ahead.
No, any commissioners have any questions for Doc? I'll just go through the list. Bill Graytop, any questions?
No, I said, I've talked to Doc a few times. I was out there yesterday. I was on a meeting with her again this morning. I could be the Doc almost. I've talked to her so much.
All right. George,
Quite.
any questions for Doc?
I don't. I just want to thank you and your team, though. All of this information that you push out has been really helpful to be able to answer questions to people who might be reaching out to us. So it's just been great to see that come out, and for us to be able to push it out. Social media has been huge with that. So I appreciate everything you and your team are doing, and Justin's team as well.
Greg, any questions?
No questions. I just want to thank you for the work, and I know you've been working with Sheriff Donelon out at the jail and trying to keep everything out there as low profile as we can for as far as the numbers that are going. And I know he appreciates the help that he gets from you, because I talk to him pretty, almost every day, or a couple times, 2-3 times a week, anyways. And he tries to keep us informed on what's going on. And I know you've been a big help to him out there as far as what's going on. So thanks for all the efforts.
David?
Real short. Thank you.
Duke?
Just kind of a broken record, but thanks, Doc. I appreciate everything you guys are doing and keeping us so well informed. So keep up the good work. Stay healthy.
Okay, thank you. So we're going to
Hey,
move on.
one more thing though. One more thing though. Sorry, don't mute me yet. I'm not done. Sorry, and thank you. I appreciate your support. I want to say Justin's a great partner. Two more things, and I'm done. One is we are just beginning this journey. Please don't think that because we're seeing a kind of a flattening of new cases that we are anywhere close to this being done. The best I can tell, we have probably less than 5% of our population that's been infected with this, which means there's a lot of vulnerable people. And when we reopen, we're going to have to be extremely careful, and we're going to have to work really hard together to make sure that we don't have a surge. And I just want to make sure you guys realize that the hard work, quite honestly, is still ahead of us. And I need your support when we do our surveillance and realize that we've suddenly gone from a relatively flat curve to one that's accelerating. So thank you for your help, and thanks for listening to me.
Thanks, Doc. Take care. We're going to move on to item number 12, Carrie, the administrator's report.
So most of what we have been working on has been COVID related since our last meeting. We are carefully tracking the governor's different orders and formulating what our county reopen plan will look like, safety measures that we will be putting in place for employees, those that interact with the public. So part of that was in our preparedness plan, but certainly we've had some more in-depth discussions regarding that internally, myself, the health department, and emergency management. So once the governor starts lifting restrictions, we will be ready to start bringing folks back to work. We were notified by AT&T that we did receive a $10,000 grant from AT&T towards our COVID response. So that will be very helpful in helping us acquire some supplies for our first responders. And our agreement with Clay Township for 911 surcharge, if you recall, back 15 years ago when we did the build out, Clay Township gives us a portion of their 911 fees towards the debt service on that tower. That agreement does expire June 30th, so it is currently under review, and I am working with Clay Township on how we'll move forward with that. And that's all.
Okay, any questions for Carrie at all? Do I have a motion to receive the administrator's report?
Great job.
Okay. All in favor?
Aye.
Aye.
Okay, those opposed. So no miscellaneous business to come before us. Receive and file packets.
Mr. Chairman, move to receive and file packets that were sent to commissioners, packets at their places, and any other information presented.
McConnell.
One support.
All in favor?
Aye.
Okay, one thing before adjournment. Normally we would do this in the boardroom, but since we're all around, it was Mr. Duke Dunn's birthday on Saturday, so I think it would be appropriate on the count of three if we sang happy birthday to Duke.
Hold on.
2, 3. Happy
Happy
birthday to you. Happy birthday to you. Happy birthday, dear Duke. Happy birthday to you.
A party like you did last year.
Yeah, that's for sure. Thanks, everybody.
That was much better, but motion to adjourn.
Also want to just add that it was Carrie's birthday also on the 12th. So should we serenade again, or Carrie, are you good?
We'll sing to her next time. All right, motion to adjourn.
So moved.
Support.
Second. All in favor? Aye.
Aye.
Is adjourned. Stay safe, everyone.
Stay safe.